Hi, this is the Health Wrap by The Hindu. I'm Ramya Kannan, the health editor of The Hindu, and I'm joined by my colleague Zubeda Hamid. This is where we discuss the most important health stories of the week. Firstly, there's a brand new blood group, CRIB, in town. There is some good news about prophylaxis for people with haemophilia. And did you know that the toxicity of groundwater has the potential to influence your health on a daily basis? This week we also talk about the massive layoffs in the IT industry and the impact of such measures on mental health. Do remember to stay on for the expert segment where our guest today, Dr. Ajit Yadav, Senior Consultant Orthopaedic Surgeon, Gleneagles Hospital, Chennai, talks about bone health and osteoporosis since August 4th was National Bone and Joint Day. In our reporter on call unit this week we have Afshan Yasmeen, Deputy Editor, Bangalore. She dials in to tell us more about the many ramifications of the mass layoffs in the IT industry. To the left of me is a QR code which will take you to the health page of The Hindu. First up, Zubeda, remember a month and some ago we did something on the Guada negative blood group. Can you believe that they've actually discovered yet another new blood group recently, and this has happened in South India?
It does seem unbelievable, doesn't it? All of these rare blood groups popping up. But yes, this was discovered by a hospital in Bengaluru. And after some analysis and some due diligence by scientists both in India and in the UK, it was classified as a never before seen blood group. And it's been called CRIB in honor of Bengaluru. So it's called Chroma India Bengaluru.
You know, it's a reminder to us that there are many things about the human body that we absolutely have no clue about. So that's something that we have to keep in mind, and you know that also keeps the hubris down a little bit if we are aware of our position in the universe as such.
How much we still don't know.
Absolutely. But talking about you know, a rare blood group, so it's important also to talk about the National Rare Donor Registry, because infusion of a wrong blood type is not just a joke, it can also kill, it can be fatal for those who are you know, in that position. So for patients with rare blood groups, the lack of donors is a big issue, and therefore the importance of establishing a national rare blood donor registry.
Yes, and speaking of blood and blood groups, let's talk a little bit about haemophilia, because that's something we've covered in the health section this week. We're talking about haemophilia care and how it has progressed from just, for instance, stopping a bleeding event after it occurs to ensuring that the bleeding event does not occur at all.
What this is usually called in medical practice is called prophylaxis, which is preventative rather than curative or therapeutic. So what we are doing now is trying to prevent the bleeding incident itself, and that might be a huge benefit for hemophiliacs, you know, wherever they are, especially for children, because this will ensure that there is no damage to the joints and to the you know, to various organs, because it prevents the bleeding from happening and therefore a critical event from happening before it happens. So the other thing, of course, as we usually discuss, is about access.
Yes.
And how are we going to ensure access to this treatment for all the hemophiliacs across the country? That is something that we have to really talk about. It's also a policy issue and should be handled with seriousness by the powers that be.
Yes, one thing is that we don't even have the correct idea of how many patients we do have in India, because doctors say that the estimated burden is and the number of people diagnosed, there's a huge gap between the two. So basically a lot of patients are not even getting diagnosed with haemophilia. And the other thing is that one state, in good news, Kerala, has started a model where they offer this prophylactic care to children below the age of 10. But unfortunately, this model is yet to be replicated in other parts of our country.
Yeah, as we know and as we've discussed before, Kerala is a forerunner when it comes to many health innovations, not just this. But it is important to see whether we can replicate the model that Kerala offers in other states as well.
And also push-up diagnosis.
Absolutely, that's at the key. Talking about blood flowing or not flowing to what is flowing beneath us, we're talking about the possible toxicity of groundwater and how that has a everlasting chronic impact on health.
Yes, the latest 2024-25 groundwater report has revealed contamination in over 200 districts in India, and that's not a small number because of the number of people who depend on this water as their source for everyday living. They have found fluorosis in Rajasthan, they have found arsenic poisoning in West Bengal, and the slow and devastating impacts this can have on people's health is absolutely, it's a massive number.
Thing about this is that it's so insidious, it's just in your drinking water. So you don't know why you're slowly falling sick, why you're having so many episodes of diarrhea, or why you're just feeling tired all the time, or children being born with deformities. So it's absolutely essential that we take care of the purity of our groundwater, and definitely these ensure that these high levels of nitrates, fluorides and arsenic are treated and possibly removed from the water source. We should also look at contamination of water. What are the sources that are contaminating our groundwater? So obviously this can't be just a health sort of issue. It has to be, once again, when we talk about One Health, it has to be a participatory, multi-centric, multidisciplinary approach to treating groundwater that will ultimately result in good health.
So not just a policy framework, but also testing models so that we can find out where these contaminants are and how to deal with them, and also to ensure that it's time, isn't it, that India makes sure that every person has access to clean, potable drinking water and something that comes out of the tap, rather than having to rely constantly upon, say, a water tanker or a pipe near your house that might not work.
Well, not only that, the number of households that are buying water and bottled water and not even being assured of the quality of the water that they are paying for.
That's correct.
So it's not as if everyone has access to this bottled water, and we have to make sure that the state is able to provide a bare minimum of clean drinking water to the people that have access to no other water source. So one thing that we cannot ignore this week is the massive layoffs that have happened in the IT sector. Jobs were apparently taken away thanks to AI. Well, what AI, I don't know, but the impact of this on the mental health of not only these individuals but also their families is something that is very key. And as a society, we must be paying attention to this kind of a problem, because in the last episode there were over 20,000 people who got the sack.
Yes, absolutely.
And this is not going to be the last of the massive layoffs. The future is going to be scarier. So it's essential that we plan for this from a mental health perspective.
Yes, absolutely. That's all that's been in the news for the past few weeks, the massive layoffs and the distress that this has caused in the IT community. So many of them are such young professionals, perhaps just graduated out of college. So many of them have migrated from small towns, from rural parts of the country to urban centers. So many of them are perhaps the first earning member of, or the sole earning member of their families. So like you said, the impacts that this can have are devastating, not just on the individual but also on the family at large that they may be supporting, and the kind of mental health consequences that it can cause are immense.
Just to say that we're not pulling this out of our hat, helpline in Bengaluru actually received 32% extra distress calls after the layoffs. So that is something that you can't ignore. I think it should be part of the organic process of laying someone off. We need to ensure that mental health aspect is factored in, both by the companies as well as by society, and if the state has to get involved, then that as well.
Absolutely, because the thing is that it's not just about a loss of a job, it's also about the loss of self-esteem, about the loss of identity. And of course the financial distress that it can cause is massive as well, and whether or not you're even going to get another job, that uncertainty can linger in your mind for so long.
Right. So let's bring Afshan in, because she's reported extensively on this.
Afshan, we've been talking about the mass layoffs that have hit the IT sector recently, and what this
what the loss of jobs is doing to the mental health of young professionals. So, you have
Yeah.
spoken to a lot of experts about this. Could you tell us a little bit about what experts say the impact of this job losses is?
Yeah, Zubeda, this is really, I mean, hitting the industry so much that early career employees, for early career employees, the loss of job is not just a financial setback, but also a blow to their entire identity, confidence, and future aspirations. Experts at NIMHANS that I have spoken to say that this instability that a layoff is causing can lead to increased levels of anxiety, depression among employees, and also self doubt, particularly as they navigate through this highly competitive job market. So, actually, understanding the psychological toll of these layoffs is crucial to building more resilient support systems both within the industry as well as in the society.
Talk to us a little bit about the kinds of impacts. You said things about self doubt, anxiety, depression. Are other negative health impacts also something that experts have flagged?
Yeah, so the loss of income just does not just impact the person, the individual, but also the families. It has a snowballing effect on the entire, individual's life. So some people would have migrated from smaller towns to cities like metros like Bangalore and other places to for the IT jobs. And once they leave back their homes, they have a lot of personal commitments, like they have loans to repay, they have children's education, and lot more things, planned investments and all that. So losing one job that too suddenly can be very distressing. What experts are saying is that common emotional reactions include shock, disbelief, the sudden loss of a job. I mean, it comes as a shock to them because it's like always not beforehand they are not told about it, and suddenly one fine day it's like conveyed to them that they are no longer in the company. So it's a huge shock. That shock feeling itself is more distressing, and it leads them into a depression. And secondly, also there is a feeling of sadness and sense of futility and unfairness. And also relationships are affected because if especially when these have been initiated in the context of a workplace, like if some relationship is building up, then suddenly loss of a job might hit a blow to the relationship. So it's like vicious cycle on the entire life of the individual.
Afshan, one of the things we often talk about when it comes to mental health is the stigma around seeking help, correct? Why is it so
Yeah.
difficult, particularly in the context of these young professionals, to speak up about their struggles and to seek professional help when required?
Yeah, actually, this difficulty is rooted in a combination of societal, cultural, and workplace specific factors. Mental health is always being, I mean, has long been misunderstood as a sign of personal weakness or failure rather than an emotional or medical concern. So this stigma has been there for ages. And coupled with this IT layoffs, most employees feel that, expressing their mental disturbances or their mental instability could lead to being judged in the workplace. And also it's been there like for long that in more conservative environments, the real strength means enduring silently. That's what the general notion and perception has been. You should endure it silently. That is what your real strength means. You should be brave and bold, and you should not expose your weakness to others and all that. So this is how I think that is what is like holding them back from getting professional help or seeking medical advice to whatever mental disturbances they are having or feeling or going through. So also the pressure to appear remaining calm and composed, that thing is also always there. So expressing emotional vulnerability can be actually seen as undermining these qualities. That's how the stigma, goes on from there furthermore. So basically the fear of rejection or being judged, and feeling that that maybe if I express and if I go and seek professional help, and if someone knows that I'm having a mental issue or a mental disorder due to this, then I may not be, they may not consider me fit enough for a future job. So that is what I think is the most disturbing factor, and the stigma around it.
You're right, that can be scary. Afshan,
Yeah.
tell us, some companies are providing mental health resources such as counselors, but employees are saying that this is perhaps not quite enough. What concrete steps do experts say that companies, policymakers, and even larger society needs to take in order to offer proper structural support?
Yeah. Yeah, actually, yeah, most of the companies have some counseling services, and they have like emotional training sessions for employees and all that. But the people whom we have spoken to say that this is not like enough. Actually, what I feel and what the experts say can be done is, there should be some kind of leadership modeling. When managers or leaders speak up about their own experiences, or the stress or that they are going through, or the therapies that they are undergoing to to minimize this stress, I think that kind of a conversation will normalize the situation. The employees will know that it's not just me. Our managers are also undergoing the similar stress, or they are also like, they are undergoing some therapies, which we can, it's not wrong to undergo therapies, or it's like not an aspect to be judged or something. So also, only if senior leaders speak up openly about their issues or mental health disturbances, and it will be only then, employees feel that there is some kind of endorsement from their senior peers and managers, team leaders, and all that. So then they feel that yeah, this is normal. We should also go ahead and take some services. Otherwise, it's all like just some counselor coming to the company and giving some training session for 45 minutes or 1 hour, which does not actually help. Most of them attend it, and it's just like a routine thing which is happening everywhere else. So it's not like that will not help the individuals to open up. In fact, they will take it as one part of the, just attend it for namesake and then leave it off. It's not actually preparing them emotionally. And also there should be some kind of conversations, I think, within the companies and within the industry on how revealing their mental health issues will not affect their promotions or future job options and all that. So that kind of conversations also, I think, if they are normalized, then I think the employees will feel confident about opening up and seeking help themselves, other than the routine sessions being provided.
So we have with us today a very, very senior orthopedic surgeon. We have with us Dr. Ajit Yadav, who is senior consultant orthopedic surgeon at Global Gleneagles Hospital in Chennai. Welcome to this show, doctor, and so glad to have you here. As discussed, we thought we'd discuss about osteoporosis and what are the implications for people of a certain age. If I may start with the first question, let's lay it threadbare. What is osteoporosis, and why does this loss of mineral density and bone mass occur? And is it tied to age alone?
Yeah, thank you very much for bringing up this topic of what is in orthopedic circles is known as the silent killer, in the sense you can literally pee out your skeleton or most of your skeleton without having any major issues during the process. So yeah, so bone mass or bone density, as it is commonly referred to, is a kind of measure of the total amount of bone you have in your body. So if you weigh, for example, 70 kilos, a certain percentage of that is bone, what do you call as dry bone weight. So if you were to take all the water out of the bone, surprisingly, it doesn't sound like a very large figure, but you're only about 4 kilos of your total body weight is dry bone. So when you get osteoporosis, I mean, grossly speaking, what happens is that this 4 kilos starts decreasing, and that's osteoporosis. So the bone thins out, not only in structurally, but as you can imagine, if the total amount of bone, which is say 4 kilos, becomes say 3 kilos, then everything becomes a little weaker.
Is it a function of age alone, doctor?
Yeah, well, age is one of the things that causes it, but most importantly, what you can do is actually, if you, I mean, there is a cycle here, in the sense when you are growing up, your bone mass is increasing. I mean, everything is increasing when you're growing up, to say till the age of 16. So you can actually increase your bone mass if you follow certain sort of a healthy sort of lifestyle, so to say. If you have some supplementary calcium intake during the growing up years, a protein diet, and a lot of physical activity, regular physical activity, you, by the time you reach 16, that is skeletal maturity, you would have actually, instead of say reaching here, you would reach a little bit above, because of all these other added factors. So you start off, when you finish your acquiring your bone mass, you are at a higher level, and from there on, of course, you have to maintain it till, if you're a female, then the menopause sets in, and for women, that is a major sort of factor that contributes to osteoporosis, because once the estrogen is stops being produced, then the skeleton becomes vulnerable to osteoporosis. And 70 to 80% of women after menopause do lose bone mass. Now,
Right.
the other interesting thing is that, say, you reach menopause at the age of 50 or 55, for example, most women will lose most of the bone mass, whatever they're going to lose, happens in the first 10 years after menopause. So, if you're going to do some kind of a test to measure whether your bone mass is coming down, I think it's good to do it in the first sort of couple of years after menopause, so you know where you are, and then repeat it so that you know if it's coming down or not.
Right. So that's a very good tip. So the other question I was, looking at, you told us, you gave us tips about how to improve bone mass, as we are growing up. But once osteoporosis has set in, is it possible to spur bone growth at that stage?
Yeah, that's a, well, till a few years ago it wasn't possible, but so there are two classes of drugs uh, to arrest menopause. I mean, a certain degree of decline in the bone mass uh, is sort of almost natural, but it doesn't get to the point of being critical. So there are some cutoff points beyond which some kind of therapy is indicated. So a lot of the drugs so far available were drugs which would prevent any further loss of bone. Um, and now, for the last sort of 7 or 8 years or 10 years, we've had drugs which will actually build back some of the bone that you have lost. And that group of drugs is continuously increasing. And there are like two or three classes of drugs now which would actually build back the bone that you may have lost. Uh, but one thing is that whatever deformity has occurred as a loss, as a result of the loss of bone, for example, if you become hunched or you sort of, your spinal curvature has changed, I mean, that will not reconstitute even if the bone stock is replaced.
Right. That's actually very interesting, and it's hopeful for a lot of older people, senior citizens, and women, of course. So the other question is, once osteoporosis has set in, how is it treated, both medically as well as surgically?
Yeah. So
When
first,
does when is surgery required?
yeah, like I said, this is a silent disease, so it doesn't really cause any problems by itself. So it remains very quiet, and then of course it manifests in fractures. The most common fractures related to osteoporosis are fractures of the spinal column. So you must have seen people who are sort of bent over like that, or lose some of the height of the spinal column. So spinal fractures are common. Second is fractures of the near the pelvis, that is the upper end of the thigh bones. Those fractures are common. Then fractures of the near the shoulders. Those are also common fractures that happen because of uh, directly related to osteoporosis. Um, so yeah, so prevention of osteoporosis involves diagnosing it first. Like I said, the diagnostic scan is the DEXA scan, and diagnosing it, by the time you diagnose it on X-rays, for example, I mean, by that point the horses have already fled the stable, so to say, and you're not really going to do much in terms. It's already quite late. So DEXA scan is the kind of gold standard of diagnosing osteoporosis, and there are various grades. So if you're in the grade where there's not much change has happened, then you can just wait and watch and repeat the scan after 2 years, because no radical changes take place overnight or in a month or 2 months. Most of these things are slow and they take time. Once it is diagnosed by the DEXA scan, then the treatment, like I said, revolves around two major classes. One is drugs that will prevent any further loss of bone, and the second lot is the one that will actually build back lost bone. The second lot, that is the building back of lost bone, so far are injectables only. So you have to like self inject. It's a small amount of drug, but at the same time, just like the insulin syringe, you get a pen which is loaded with the drug, and you have to take a shot, self administered shot every day. For The treatment continues for 1.5 years. So that also helps to build back the bone stock, and the major advantage of that is not so much decrease in any pain that you had, but it certainly contributes to decreasing the number of spinal fractures that people have with age.
Right.
From the surgical point of view, by the time you have fractures to deal with, uh, the fractures are a consequence to the osteoporosis. So the remaining bone stock, is what the challenge is to the surgeon, and
Right.
most of these are involving some degree of reconstruction of the either the hip bone or in the upper end of the shoulder. These fractures, so they require reconstruction and replacement and or replacement. So fractures of the upper femur, for example, near the pelvis, it's a common thing to replace that if there is a fracture uh, involving that part of the pelvic bone. Similarly, for the shoulder also, some fractures can be put together and reconstituted, and the fracture will join. And if that is not possible, then the fractured part is taken out and a prosthetic joint is put in its place. There are bone substitutes available. If you have to reconstruct, for example, a fracture of the hip or a fracture around the shoulder, bone, human bone is available from bone banks, which is donated bone actually. Uh, So that bone can be used to uh, build back some of the bone stock intraoperatively, so that there is, and over a period of time it consolidates and gets incorporated into the skeleton. There are some synthetic, that is factory made substitutes also, which are more like pastry kind of material, and then you sort of mix it and it becomes hard on the table itself, and those are used usually to either fill in sort of literally holes in the bone because there is no bone there. So you can put in these synthetic fillers, and over a period of time, they get incorporated into the bone, and it is a generally a slower process than, for example, the incorporation of bone that you got from a bone bank.
Right. So that's actually fascinating, Doctor. So maybe, for our last question of this session, you've given us a lot of tips about exercising, and that's important to build bone mass. But what about a diet? Are there things that can help you build bone mass as you grow up in terms of a diet?
Yeah, I think, like I said, till the age of 15, just exercise, protein which is commensurate with the growing up, and supplements, and I mean actual calcium supplements will help. But once you reach say the age of 15 or 16 and you're skeletally mature, then taking from 15 to menopause, for example, and we're talking of otherwise healthy normal people, it's very difficult to change the amount of uh, calcium in your body. So even if you do take calcium supplements, uh, how much it helps is really difficult to quantify, because the amount of calcium which is, say, circulating in the blood, which is ionic calcium, and that ionic calcium is derived from the bone in the body. So the body melts a certain amount of calcium, literally, say, and keeps the amount of calcium which is in circulation in the blood to a very finely controlled, literally milli-equivalent levels. So quite often the calcium tablets that you might take, they uh, pretty much could come out unchanged at the other end.
Right. So,
So improving bone stock between the ages of 15 till menopause, if you are otherwise quite healthy, can be quite a difficult task, because you can't just take drugs, or I mean there are some other synthetic drugs to sort of try and increase the bone mass, but those are not really required unless there is a pathological change in your bone stock. Between the ages of 15 to menopause is really difficult to change your bone stock if you are otherwise keeping up with a healthy lifestyle. It's difficult to decrease your bone stock, or to change it substantially by just taking calcium supplements, for example.
right. So, fascinating discussion with you as always, Doctor. And I'm sure for people watching this, there are a lot of tips as well. Because if we are lucky, we get old. Thank you so much for helping us prepare for that. And with that, we come to the end of this segment. Thank you so much, Doctor, for joining us.
Thank you very much, Ramya.
So what's our fun fact for today, Ramya?
Yeah, so since we are on the subject of rare blood groups, let's stay on that for a bit. Did you know that the rarest blood group in the world is something called Rh null? It's so rare, it's called the golden blood.
Wow.
Yeah. So it is characterized by the absence of all Rh antigens in the red blood cell. And it is so rare that fewer than 50 individuals are supposed to have this blood group. Like
That's pretty incredible.
absolutely. And that's a wrap. Thank you for watching the Health Wrap. Do tune in for our next episode on August 22nd. Thank you.